Judges, welcome back. So what we'll do is we'll have the judges introduce themselves, and then I will turn it over to Team Onward. Team Onward, you can introduce yourselves and then get right into your presentation.
Okay, thank you.
Hi, good afternoon, everyone. Team Inland Empire, Team Onward. My name is Victor Carrasco. I'm the CEO for East Los Angeles Doctors Hospital. We're a safety net hospital in East Los Angeles, and we also hold a lot of capitated lives in our system. Certainly, this is what we do every single day, and I look forward to your strategic plan and our discussion around your expansion and what your conclusion is. Thank you.
And good afternoon, everyone. Demetrius Alexo here, President and CEO with the Hospital Association of San Diego and Imperial Counties, and would echo what Victor just said. Looking forward to your presentations. I know there's always some creativity and exuberance, so really looking forward to hearing your thoughts.
Hi, everybody. The now unmuted Mark Lisa. I'm the Chief Executive Officer of Tenet Health Central Coast. We are a 2-hospital market here in San Luis Obispo County. I'm looking forward to your presentation. So far, they've been great, and I think yours is going to be help continue that expectation. So thank you for your hard work, and I know there was a lot of blood, sweat, and tears. Looking forward to hearing it.
Thank you.
Hello, Onward. I'm a principal with CoPo Solutions. Excited to be here today. Really appreciate your pulling together a presentation for us. The case happens to be one that we worked on as an organization a few years back. So I'm personally invested in this and excited to see what you came up with. Not an easy one to pull apart. So looking forward to your process and your assumptions. And again, thank you for joining us.
Thank you.
Hi, I'm Bonnie Panlasigi. I'm the Chief Operating Officer at St. Mary Medical Center in Long Beach with Dignity Health, and also now part of Common Spirit Health. I'm looking forward to your presentation. I think it's awesome as students that you get to do something like this, and it gives you a little glimpse into our everyday challenges. And so thank you for doing this for us.
And I'm Kim King. I'm the president of Strategy Advantage. We're headquartered here in Los Angeles. I spent the first 10 years of my career working inside of hospital health systems, in my case at Cedars-Sinai here in LA. Started the company in 2002. We're now a 20-person team, and we do growth strategy, market expansion strategy for hospitals, health systems across the country. Really love strategy, and we can't wait to hear how you're going to inspire us today. And I just want to wish you good luck. So thank you for being here with us today.
Thank you.
Thank you.
Thank you, judges. Team Onward, the floor is yours.
All right. Thank you so much. Well, my name is Sarah Gadd. I am the team leader for Team Onward. The other presenters with me today are Andres Woodruff and Leal Temsa. And today we're going to be presenting our Onward expansion plan for the Inland Empire. Before we begin, we wanted to give a quick thank you to Alexis McDowell, our faculty and advisory board. Thank you for all of your support. We're ready to begin.
You may begin.
So we'd first like to present our proposal, which is to rent out 6 not-for-profit federally qualified health center clinics that will hold behavioral health, medical, and dental departments and have telehealth capabilities located in these listed locations in the Inland Empire. These areas have been specifically chosen based on their community needs and population density. Federally qualified health centers are community-based healthcare organizations that receive funds from the Human Resource and Service Administration Health Center program to provide primary care services in underserved areas. And FQHC was the best choice for our proposal because we want to be able to provide opportunity for improvement to cover health disparities in underserved areas in the Inland Empire. For this reason, providing telehealth and transportation opportunities to areas in need of health services will be a vital component to our proposal. And catering to the CalAIM waiver requirements by providing well-rounded care with the departments provided, we will be able to receive financial rewards from the waiver, as well as quality incentives from Medicaid and funding from the Human Resource and Service Administration, as we will fulfill the requirements for an FQHC. We will also be catering to the safety net population as a federally qualified health center by delivering a significant level of healthcare and other needed services to the uninsured, Medicaid, and other vulnerable patients. Here, we have also provided our initial provider list for both 1 clinic and 6 clinics. This list includes and is able to cover our initial patient enrollee proposal with full plans of expanding our provider list as we project organizational growth, which we cover more later. Now, here are our assumptions. For our proposal, we will be renting out already built medical facilities that are already configured and have basic medical equipment available as to save costs, as we are assuming they are available in these areas. Next, as this expansion project is from a Northern California health organization, we are assuming the identity of a large Northern California health center with a strong presence in the state with enough funds to support the size of this project. We specifically also looked at academic medical centers that could benefit the Inland Empire and cater to the provider shortage by implementing pipeline programs that would send future medical providers to the Inland Empire. Lastly, our budget proposal simply includes only how our expansion project would fare based on our sales and reimbursement only, and not including potential incentives, federal dollars, and funding from government sources like the CalAID waiver, Medicaid, and the HRSA, which I mentioned previously. Now I'm going to hand it off to Leal to discuss our market scan.
Thank you, Sarah. So in order to provide you with a better overview of the Inland Empire, I will go over some aspects of the market scan, starting with population and needs. The Inland Empire has a population of 4.5 million people between 2 counties, Riverside and San Bernardino. Over the past 5 years, the population has grown 5.5% and 12.7% over the past decade. And this growth is expected to continue and increase the job market as well. The Inland Empire residents experience poor health outcomes, both physical and behavioral. And this is attributed to the fact that they live in poverty, where 19.9% of the Inland Empire residents report fair/poor health conditions. In terms of healthcare systems, the Inland Empire is ranked 50 out of 57 California counties in clinical care, which includes ratios of population to care providers, preventive screening practices, and insurance coverage. The top health needs across the region are identified by health outcomes, social determinants, and clinical care. Health outcomes include mental health and alcohol, drug, substance abuse, and chronic diseases. Social determinants include challenges in transportation, affordable housing, poverty, food insecurity, as well as education and awareness. And clinical care includes lack of access to healthcare because of provider shortage and limited preventive healthcare. UCR Health and Riverside Community Hospital are our biggest competitors, where RCH has the largest ER and trauma center in the Inland Empire at 62 beds, with a majority of the revenue coming from Medicare, 52% for inpatient and 36% for outpatient. With UCR Health being a fast-growing health system that is connected to a medical school with telehealth capabilities and being research-focused, they are also a major competitor. Honorable mentions include Kaiser Permanente and Dignity Health. We propose 2 strategic partnerships, one with IEHP and one with LLUH. IEHP is the Inland Empire Health Plan, and it is one of the top 10 largest not-for-profit Medicare and Medicaid plans in the country. They serve more than 1.2 million residents in Riverside and San Bernardino. It is a crucial health plan when expanding in the Inland Empire, with a medical population with over 6,000 network providers and providing coverage for 9 out of 10 medical enrollees. They have also recently started a new fellowship program to keep doctors in the Inland Empire, which would be helpful as a partner in addressing provider shortage. IEHP is a good partner in delivering care to the region's medical population and for generating positive relationships with the provider community. And the second partnership we propose is with Loma Linda University Health, which we'll go more into depth about later in the presentation. It provides an opportunity for servicing medical patients with a 16% medical discharge rate. It is a multi-specialty hospital with strong connections. And given the friendly relationship of our organization with Loma Linda University Health and the previously discussed opportunities for creating an aligned network to better channel acute care volume, we believe partnership presents a great opportunity for collaboration. The next market scan aspect that I will discuss are the challenges and opportunities for expansion. One challenge is provider shortage, which can be used as an opportunity for incentive and pipeline programs through partnerships, as Sarah has mentioned earlier. And the second challenge is addressing rural community health needs, which also provides an opportunity for increased accessibility using telehealth, which will also help with the provider shortage challenge, especially since 84% of survey respondents in the Inland Empire have reported that telehealth has reduced barriers to attendance, and 92% having felt that their needs were being met with telehealth services. And now we will go more into discussion about membership and enrollment expectations for our proposed expansion. Back to you, Sarah.
Thank you. So we expect that within our first year to have 65% of Medicaid enrollment, and for that to continue to grow based on our market scan and aim to serve underserved communities, we expect to reach 200,000 members within 5 years. We calculated this by using poverty, which is 20%, as our disease prevalence rate, then taking into consideration the enrollment period, the likeliness of individuals to become patients, our expected growth of our clinics through our market research, and the population growth rate that Leal mentioned. Then using that same calculation and developing a trajectory rate, which is available in our appendix, we were able to then calculate that there's a possibility of reaching 300,000 members across all 6 clinics. And it will be primarily through utilizing our strategic partnerships with IEHP and Loma Linda University Health that Leal mentioned earlier, among the other ones that are listed here. By utilizing a strategic partnership with these health plans in Loma Linda, we can capture a greater number of patients through referrals and advertising from Loma Linda. Which brings me to talking about Loma Linda. So our most strategic partnership will be with Loma Linda University Health, which has 4 different hospitals in the Inland Empire, is a nationally ranked health system, and is responsible for 13% of Inland Empire discharges. Loma Linda is a strong contender for a partnership because they would also help provide pipeline programs to feed the provider shortage and incentivize other individuals to service the Inland Empire. The organization we represent already has a friendly relationship with Loma Linda and has previously discussed the opportunities to create a line network to better channel acute care volume. They have discussed potential affiliations to leverage shared resources with other health systems and physician network partners to engage in value-based care and integrated care models more effectively. Based on their financial performance, they have a market share greater than $1 billion with Medicaid representing a large amount of their revenue. This will be particularly useful to our efforts in becoming an FQHC that primarily serves individuals that have Medi-Cal or Medicare. With our aim to primarily provide to Medicare and Medi-Cal enrollees, this would also be beneficial for both stakeholders, as it can be projected with additional aid being provided to the Medicaid population, there should be increased revenue for them and us, as we will be providing primary care, and Loma Linda will provide specialty care as needed for our patients. Also, because Loma Linda is the only level 1 trauma center in 4 counties and with excellent marks as both a children's hospital and excellent marks in health report cards, Loma Linda University Hospital is an excellent strategic partner to have and would be a win-win partnership for both stakeholders. We would be able to capture patients that would be redirected from their emergency department to us and then provide additional health literacy to support patients in these underserved communities. Now we'll hand it over to Andres for the budget.
Thank you. As we move into the budget, our team concluded that there are various areas to focus on in our proposal to expand into the Inland Empire with 6 not-for-profit clinics. Taking a closer look, please see the total startup cost highlighted in red, in which you will find a breakdown for 1 clinic versus the full 6 clinics. We calculated that it would be more cost-effective to rent as opposed to outright buying properties for 6 individual clinics. And based on the current market and what was available in the various regions, we calculated that the initial cost to rent would total $50,000 per clinic, totaling $300,000 for 6 clinics. Equipment costs varied, as we would need EMR systems, ultrasound equipment, EKG machines, ventilators, imaging equipment, and general medical equipment, along with miscellaneous costs that would include exam tables, computers, furniture, etc. You can refer to our appendix on slide 20 for a full breakdown of this. Again, you will see the total startup cost for 1 clinic versus 6 clinics highlighted in red, in which for 1 clinic, the total cost amount to $743,100, and for 6 clinics, the cost total $4,343,600. Moving into the total budget needed for year one, we factored in the total startup costs plus total employee compensation costs across a variety of providers, plus insurance costs that include commercial property insurance and malpractice insurance, plus monthly expenses per year that include utilities, maintenance and repairs, and of course, rent. Again, you see the comparison of these costs highlighted in red from 1 clinic versus 6 clinics. The budget for year one for 1 clinic totals $3,150,173. The budget for 1 year for 6 clinics totals $18,786,040. In looking at our company evaluation, we want to pull your focus to the highlighted red box entitled percentage of market to be captured. Through our evaluation of the company, we calculated that 33% of the market is intended to be captured, which goes hand in hand with our desired membership amount. Because we are a nonprofit, generated revenue is not the end all be all, but because of our foreseen partnerships and the intent to recoup the funds used for expansion, it is vital to break this down and conduct a break-even point analysis of how much revenue generated is needed to see a positive return on investment. In the analysis, we chose specific factors that would contribute to the needed revenue in order to break even. Each factor is broken down and contributes to a certain percentage that totals the full 100%. These factors break down into monthly rent, monthly utility costs, monthly maintenance and repair costs, monthly insurance costs, average monthly wages and benefits, a monthly marketing budget, additional monthly expenses, and monthly debt servicing costs. Because we are a federally qualified health center and will be receiving government funds upwards of $2 million, it is important to note that we did not factor this into the needed revenue, as it is considered separate from this. Thus, our needed revenue with a sales margin of 100% highlighted in red is $1,195,888.48. Based on our projections and with what revenue we would be expecting over time, our opportunities for growth are as follows. Initially, we want to incorporate community engagement programs. Then over a year period, we want to amplify our provider recruitment. And in 2 years' time, expand our specialties being provided. And in 5 to 7 years, ultimately expand our reach with more federally qualified health center clinics. In addition, we expect to tap into further clinical partnerships as long as the interests are aligned. As we conclude, let's touch on a few final thoughts. Our final recommendation is to open 6 not-for-profit federally qualified health center clinics in which we will use a strategic partnership with Loma Linda University Health. We plan to capture 200,000 members over a 5-year period at 33% of the total market. Our total budget for year one for 6 clinics amounts to roughly $20 million and is more than enough capital to make this expansion happen. We are confident that this partnership with Loma Linda University Health and the Inland Empire Health Plan will be successful. The Inland Empire poses a plethora of growth opportunities and provides a great look into the future. I want to leave you with a quote that Harriet Tubman once said, in which every great dream begins with a dreamer. Always remember you have within you the strength, the patience, and the passion to reach for the stars to change the world. We're all dreamers and want to make an impact through action and change. So let's begin that journey now. With that being said, thank you for giving us the opportunity to present today. We will welcome any questions the judges have now. Thank you.
Thank you.
I liked the breakdown of the expenses in the budget. I think that was well thought out as far as the operational costs. Right. Would you say that you would partner with Loma Linda, so you would be using their name as part of your signage, or how would that work?
I'm sorry?
Would you be using Loma Linda's name in partnership with them, or how would that work for your signage?
Yeah, it would be a joint venture. So their names would essentially be on the clinics as well.
Mm-hmm. Okay. And then did you do a factor of an analysis of outpatient versus inpatient for your members?
I'm sorry.
Outpatient versus inpatient, kind of the reimbursement to the hospitals and that cost factor?
We had done an analysis for Loma Linda. It's actually in our appendix. As far as for our own, what am I trying to say here? Our own
we did not
clinics. We did not. No, we did not.
Okay. So just focus primarily on the clinic.
Yes.
Yeah.
As our clinics will be only for outpatient, and we have the full plan to refer for specialty or longer term care to Loma Linda.
Okay.
Demetrius here. One question. Appreciate the presentation. Obviously, you did think about a lot of things, and I'm just sort of curious. You identified renting out 6 FQHCs with a variety of locations, and yet from the health system provider side, just partnering with Loma Linda, how do you ensure if they do need follow-up specialty care, et cetera, that they aren't going to be traveling great distances to access that care?
Well, I think with the nature of how the Inland Empire is there isn't many opportunities for individuals to have specialty care. That's something that was not only stated within our market scan, but also within the case itself, that there is that prevalent issue. There is the potential, as we mentioned in our opportunities for growth, to then align ourselves with other clinics and other hospitals in the area so that we can then hopefully redirect our patients to closer care.
And also to add on to that, with our partnership with IEHE, the Inland Empire Health Plan, that would also help us transfer our patients to one of their 6,000 provider networks. So that partnership will also help us in that aspect.
Quick question. I'm looking at your entire presentation. The thing that really popped out to me was the shortfall of revenue of about, I think it was $1.1 million, right? First question is that on an annual basis or is that over a 5-year time period? And then the second question and the follow-up to that is, given that you stated you're not going to use the HRSA's revenue or any other type of government funding, how are you as a 6 FQHC clinic going to supplement your revenue to sort of plug that shortfall?
So to answer the second question in regards to the supplemental income, I didn't say we weren't going to use it. I said we weren't going to factor that into the needed revenue. We're going to definitely use it because at that point it's free money, if I'm being honest. Where it's definitely going to get factored in. It's just that wasn't part of the specific analysis in order for the revenue needed. As far as that $1 million revenue, that's going to be on a yearly basis.
I have a question. You did a nice job of laying out kind of the win-win rationale for partnering with Loma Linda. Nice job on that. And you also mentioned that you very much see a strategic partnership with IEHP. So why would IEHP want to be your partner? What's kind of the win-win, what's in it for them rationale associated with that very important partner as well?
I'll take it. So as Leal mentioned during our presentation, IEHP is one of the largest health plans, and they do provide membership to 9 out of 10 Medicaid enrollees. So if we have the intent to be in the future primarily serving 90% of that Medicaid population, I think that we would be a great benefit to them and capturing members and actually making sure members will hopefully utilize their membership as well and to come in to have services done. One of our big points was to have strong community outreach programs so that we could have an engagement with our patients so that they'll come and for the health education purposes and for their own personal health and for preventative services.
Team Onward, thank you so much. Great job.
Thank you.
Thank you so much.
So the judges will head to their breakout room and we are going to bring in the final team.
Thank you for the opportunity.